My name is Per von Menzer, and I'm the CEO of Famnovo, a clinical stage drug development company. Our vision is to improve people's quality of life through innovative, sustainable, and effective pain relief medicines. And I'm proud today to be able to present both the company and our lead candidate, PN6047, a phase 2 ready drug for neuropathic pain with first-in-class potential. That is, it can be the first delta agonist reaching the market. In short, we develop quite novel drugs for neuropathic pain treatment. We have a team with vast experience in drug development. As I said, the lead candidate has first-in-class potential, and we have patent protection in all major markets until 2041, including the expected extensions. In the recently finalized phase 1, PN6047 was completely safe and well tolerated up to exposure levels that are predicted to be effective in humans. And we are now in the planning phase for the phase 2A proof of concept study in neuropathic pain to start mid next year. We are raising at the moment a Series A of up to 30 million euros to finance phase 2A, and I'll come back to that a bit more in detail. And very positive, we were in July this year awarded the EIC grant of 2.5 million euros plus the full blended financing opportunity of 15 million euros equity, which of course is a great support and also validation from EIC of our project. Now, there is a huge unmet medical need for patients suffering from neuropathic pain. Neuropathic pain usually ruins these people's quality of life, both physically, socially, and most times even financially. It affects up to 10% of the adult population worldwide, so it's a massive burden for society as well as for the patients, of course. Unfortunately, current treatments such as anti-epileptics and antidepressants, originally not developed for neuropathic pain, are usually poorly effective and associated with severe side effects. The market represents some 10% of the overall chronic pain market, so it's a pretty big chunk of that, and it's expected to grow quite significantly and reach $8 billion by 2027. So what is PN6047 then? Yeah, it's actually a potential game changer in neuropathic pain. As I said, it's a very novel, very selective delta opioid receptor agonist. In other words, DORA, we usually use that abbreviation. It very effectively reduces neuropathic pain with the symptoms of allodynia and hyperalgesia in animal models. And as I touched before, in the recently completed phase 1, it was safe and tolerable at exposure levels that can be predicted to be effective in humans. So a bit more in detail about our solution. As I said, it's a very selective delta agonist. It is an opioid, but it's completely different from conventional opioids in the sense that it only activates the delta receptor. It's 100,000-fold selective on the delta versus the mu. And so far we have validated that we don't touch the mu, and thereby we don't create any of those unwanted side effects that are associated with the mu receptor. So we get very effective pain relief and basically no side effects. Another property that has been developed in our, we call it the latest delta agonist, so far developed, is biosignaling. And that means that when we activate the receptor, we primarily signal down signaling in the receptor through the G protein. And there we get the effects that we are looking for. We get the pain relief, we get some antidepressant effects, even some anti-migraine and anti-cough effects. We have evidence of that in preclinical studies, all of that. But also by avoiding the arrestin pathway, we don't see any tolerance buildup, which is crucial, of course, for any medication of this kind. And we also avoid some other side effects that have been seen in early development, such as the risk of seizure. We've actually been up to 2 grams dosing in rodents in the toxicology studies without seeing any risk at all of seizure. And we have maximum effect at 3 milligram. And with that said, I'm coming over to the slide where we have just one piece of data. That is the sciatic nerve ligation model, which is a gold standard in neuropathic pain. It basically measures allodynia, which is a hypersensitivity. And in very low milligram doses per kilo, we see very good pain reduction. And in 3 weeks of dosing, we didn't see any tolerance buildup. Completely safe and tolerated in animals, and now also validated in humans, as I said, in the phase 1 study. A little bit of data from the phase 1. In this graph, the blue line here, you see the average exposure at trough level, so just before the people get the next dosing. So this is actually then the lowest level that you have in the blood. And you can see that we reach a steady state after 3-4 days. And the upper red line here indicates the exposure level then at trough, steady state, at 157 nanomolar, but that's not so interesting. The most interesting is the free fraction, which is the active part. And that should be compared with the lower red line, where you have at 1.5 nanomolar free fraction in the rat, in the SNL pain model, maximum efficacy. And this indicates that we have a very large therapeutic window to play with when we move ahead into efficacy studies. So that is, of course, very reassuring when we now move ahead into the proof of concept study, which is a classic randomized double-blind placebo-controlled crossover trial aiming to have 40 evaluable patients. And the study is, of course, designed to investigate safety, tolerability, and efficacy of PN6047 in patients with peripheral neuropathic pain and the symptoms of allodynia. And this is very important, the clinical strategy focusing firstly on neuropathic pain, which is known to be a difficult area. The strategy is to go for only patients with the symptom of allodynia, and they can be recruited quite concretely by using semi-quantitative measurements and select utilizing them. So that is the strategy to move into phase 2A. And that will maximize the probability of actually detecting efficacy, that we have a very homogeneous patient group. Just a little bit more data, and that is just to talk about the fact that PN6047 has potential in several other indications as well. For example, chronic cough, where we have good preclinical data, and that's basically pain in the lungs. And maybe even more importantly, opioid withdrawal syndrome. We are currently running a preclinical program with 2 top universities in the US, funded by NIDA, the National Institute of Drug Abuse. And through this program, you could say that OVS has sailed up to become maybe the most interesting second indication for us. We have seen preclinically now in many different models of hyperalgesia, both peripheral and cephalic, which is a migraine-like, as well as anxiety and depression, that we very effectively reduce the 2 main symptoms when you are withdrawing morphine or fentanyl or anything else, which is pain and anxiety. And we are in discussions now with NIDA for a application that we will seek funds actually for clinical studies as well during next year, and hopefully support from NIDA. This is a very high focus in the US from NIH and NIDA to move this forward. So if we look at the overall, helicopter view on the planning, we have completed the phase 1, as you know, and I talked about that. We're now raising funds to finance the proof of concept in neuropathic pain. And if capital is available, that means the full amount, up to 30 million euros. We will also start POC 2 and 3 studies. Following a successful proof of concept, we will seek partnership with pharma for continued development and commercialization of PN6047, either through out-licensing or a trade sale. And deals in the space indicate a potential total deal value of at least 600 million euros. Most likely we're talking about a value up to 1 billion euros for an asset that has shown safety and efficacy in neuropathic pain. If a suitable partner is not available at that specific time, we will of course continue into phase 2B and raise funds for that as well, either in the private market or possibly through an IPO. I touched the team before. I'm very proud of the team we built up over the last years. We have together over 300 years drug development experience from pharma companies like AstraZeneca, Lundbeck, Leo and Novo Nordisk. We have a team that can make this happen. And to summarize, Famnoven PN6047 is a great investment opportunity. It's effective in pain relief in animal models, safe and tolerable, and also that in exposure levels that are predicted to be effective. It's fundamentally different from conventional opioids, and we see no risk of abuse potential at all. Potentially many indications. We are ready to move ahead into phase 2A with a very large therapeutic window. And last but not least, again, we have a team that can make this happen. Thank you.
Thank you very much, Per. We've got time for a few questions if anyone wants to volunteer. Any questions?
Thank you very much for a good presentation. Oh, sorry, you can't hear me, right?
Yeah, I can. There is
Okay.
Yeah.
Good. So a M&A is of course never a certainty, and you already mentioned next steps would either be IPO or through the private markets if you have to fund the next phase. But if we're going into neuropathic pain, how does a phase 3 or a phase 2B look like? How much do you still need in the next phases in terms of funding?
That's an important question, and I didn't mention that in this short presentation, but what we are planning for in the capital we are raising for the Series A is to build in a number of very important things to do to be prepared for phase 2B or phase 3. So in that plan we have long-term talks, we have DDI studies, we have formulation development studies, etc. So there's a big package which needs to be done to prepare for phase 2B.
Yeah, sorry, I meant financially speaking. What are the financial requirements to set up a phase 3? How many patients do you need? So more or less, what do you need in the next steps? Is it still in the double-digit millions, or how does the typical pivotal phase 3 look like?
Yeah, I'm not knowledgeable to that level, but already a phase 2B will be a significantly larger study. And I think we have made some rough estimates that we are talking about 50-60 million euros. Phase 3 will be vastly larger than that. And as it is a pain study, and even if we have demonstrated, maybe continue to demonstrate that we don't see any abuse potential, we don't see any side effects related to conventional opioids, etc., we are certain that there will be demands for quite large phase 3 studies. So the capital need will be very large. But touching the M&A question, I think knowing what's going on in the space and seeing the rate of licensing or acquisitions, we expect that there will be a very large interest from pharma when we have shown efficacy in humans. Nothing is certain, but I think we are pretty convinced that there will be a big interest.
Hi, Pierre. Thank you for a very nice presentation. So, as an actively practicing physician, my experience is that patients with neuropathic pain can come across as being rather heterogeneous. Within that bucket of neuropathic pain, how do you plan to select those that will benefit the most from your therapeutic? Or in other words, do you have a biomarker strategy in place to select patients?
I touched it briefly. In collaboration with the KOLs and advisors we have, the clinicians and the experts, we developed this strategy of going for neuropathic pain patients with allodynia. And when we speak about allodynia, which is pain on the skin which shouldn't be painful, in the last decades there have been a development of measurement systems where you brush the skin, you press the skin, etc. And you can use that to, in a more comfortable way, actually determine if they have allodynia or not. And that is one of the reasons we picked neuropathic pain and this symptom, because we believe that we will be able to actually stratify this and have a homogeneous patient group. On the other hand, when you then move forward, we need to broaden that, of course. But for the proof of concept, we are convinced that recruiting only patients with allodynia will maximize the probability of success.
Got it. Thank you.
Yeah.
We just have one more quick question.
Thank you. What does the competitive development landscape look like for this type of therapy? Are there any other companies with similar drugs in development that are not prone to abuse? Are PharmNovo set to be first to market for this type of therapy?
There are very few delta agonists in development. We know of two. One is parked due to, I think, company and financial problems, Trevena in the US. And then there is Nippon Chemiphar in Japan having a phase 1 development for depression. So those development projects are behind us. We don't really know much. There's no data available, so we can't say really of the quality of those drugs. What we know is that we have come to a development stage where we have a extremely clean drug, you could say. And in the NIDA program, we reran all the preclinical studies we had done before with the same or even better results. And we have run all the gold standard abuse potential studies together with NIDA as well. So we feel comfortable. And there's definitely possibility to reach market first in this space. Yeah.
Thank you.
Thank you very much, Per. That was a fantastic presentation. Thank you.
Thank you. Thank you very much.